What's up guys, Holden here, HMOM Fitness. Today we're going to do a video on some knee therapy techniques. So for this, I'm just going to go over just a few exercises we can do for knee pain. Let's keep it to patella tendonitis, quadricep tendonitis. So I'm just going to go through what you should do and some techniques that you can do. So here we go. First thing is let's go with our right knee. Let's do the barbell quad smash. Okay. So just get the bar over. Okay. Once again, put your other leg, anchor it. And this is really important because that quad, rectus femoris, is what dictates how much tension will be on that patella. Okay, so if your quad's really tight, it's going to be pulling that force this way, and if you top that with jumping, walking, squatting incorrectly, you're going to put a lot of shear force on that. So the least we can do is really loosen up this quad and really just have it a lot of slack on there. Okay? And from there, simple, you can go to the calf smash. Okay? So you can do it like this, or you can get on your knees and put the bar on your calf. For the video purpose, show you this one. Okay? And from here, I like to add some extra weight. Put your other leg on top, or put like a sandbag, and you're gonna just try and tack and floss too. Try and get that ankle through range of motion. Okay, side to side, and you just want to hang out here because this calf attaches right on that femur. Okay, so by having a better calf range of motion, dorsiflexion, it'll allow you to get that knee in a better position because you'll have the ability to flex it, and it won't feel a lot of tension, because if you have tight calves, you'll probably get in a little more flexed position in your knee, which will always put a little more shear force on that quad. So we're always up that calf. Also, we gotta get the dorsiflexion going, because if you don't have that dorsiflexion, you're gonna compensate the hip or the knee, and that'll cause some more problems. So let's go after that quad, calf. Next thing, where did the peanut go for? I think my dogs eat a lot of the peanut. Alright, so the other thing, you gotta take a peanut, but I guess for this case I'll just use a softball, and we're going to go after that anterior shin. Okay, so anterior tibialis. So why we're doing this is because there's a huge fascia sheet of connective tissue that kind of comes down from your knee and kind of inserts at this anterior tibialis area, just this whole area in your knee. So we can loosen this up. That whole kind of connective sheath will loosen as well, and it plays a role in that knee pain, because this connective tissue is also connected to the quads. It just kind of runs all the way down. So if we can loosen this up and this up, there'll be a lot more slack here in the knee. Okay, so anterior tibialis, we're on that lateral side of that tibia. Okay, the other thing we're going to go after is the hamstrings. Okay, so why don't you get in the band, we're going to do just some hamstring flossing. So you got the band on the high hip. From here, you get your leg bent, and you try and move my other leg. You bend it, extend, bend, flex, extend. Okay, so we're firing that quad up to get that hamstring into a good range of motion. Okay. While the femur is in a very good position from the band distraction. Okay. So that hamstring comes on the back side, inserts on that back side of the knee. Okay. We can also do it with this ball on the bench. Just attach the ball in the back of your hamstring and just tap and floss there. Okay? And then the last part of this, I'm gonna just talk quickly about if you do have any sort of swelling, discomfort in your knee itself. So I've kind of gone away from the whole icing thing, because when you ice, you slow down that process of healing and that inflammation process, and all that fluid can't get out of that area. So what I think is a better idea is to do some sort of compression. So if you have like a Voodoo Floss band from Rogue Fitness, what it is like a huge rubber band, and you tie it around the area and you put a lot of compression, and then if you elevate it too, the whole idea is you're getting all that fluid back into the lymph system, so it can be cleaned out and really bring in some new blood and all those really good cells you need to help the healing process. And heat is good because it brings in new blood, but it really initiates and promotes that inflammation process, and inflammation is what starts healing. When something's inflamed, it's telling your body that it's trying to heal it. That's why we get the pain. So with icing, you're stopping that natural healing process, okay? And on top of that, you're having a lot of static fluid in that area. So icing is going to slow it down, keep it static, not let it go back into that lymph system. So here's a good plan to do, is get some Voodoo Floss, let's say a knee pain, you wrap it around the area, you can see it swollen, okay, elevate it, so we promote it to get the fluid back in the lymph, and then try your best to get that joint through a range of motion, okay? So, if you're doing for knee, try and do some knee extensions, flexions, activate your calf. What that's going to do is when you activate those muscles, you're going to promote that movement of all the fluid back into the lymph system. And when you move, that is how you will activate and bring new blood in and get all the bad waste out. So prioritize movement first. Try and get the joint moving, and then from there you can Voodoo Floss it and get some heat on it. Hot tub is great, but for once, try and stay away from the ice. It might be a little more painful because ice, will numb it. But from an actual healing standpoint, heat, compression, and movement are your best bet. Okay. So for knee pain, guys, do some of those exercises I showed you, and then let's do some heat, compression, elevation, and try and prioritize movement. Okay, try and get those muscles around the area to move. If it's your toe, your feet, try and dorsi, plantar flex. And if it's your knee, try and extend. If it's a shoulder, try and move it around. The point is that those muscles will activate the lymph system to start pulling all that fluid out, carry it. So use gravity, use your muscles, and use heat and compression to get all that lymph out. And forget about the ice. So there you go, guys. Think about it, and see you next time.